Our psychology training program is acknowledged as one of the best in the country. That has allowed us to be able to recruit some of the most outstanding and best psychologists from across the country into our research programs.
We have three types of postdoctoral fellowships. The first is we have APA accredited postdoctoral fellowships. Those are primarily clinical in emphasis, and they're in the area of child clinical, neuropsychology, and adult clinical. We also have research training postdoctoral fellowships. Those are primarily research training.
If you want to do treatment research, it's a wonderful place to be, particularly if you're interested in getting funding from the National Institutes of Health. It's fantastic. I came here as a postdoc 7 years ago on a T32, got fantastic training, wrote a grant, submitted a grant 9 months after I got here, got funded. I have great environmental support, great mentorship, great collaborators.
The last type of fellowship is an investigator-funded fellowship, so those tend to be linked to specific investigators and specific research labs.
My postdoc was a 2-year postdoc in just research-based because I didn't really feel like I wanted to go fully into like the clinical spectrum. I really enjoyed doing clinical research, so looking at how we can apply research to different clinical populations, but I really kind of wanted to be a full-fledged researcher.
So if you are somebody who's coming in from more of a general psychology background, but you have an interest in drug abuse or alcohol abuse, say, you will get kind of immersed in learning about the various aspects of those content areas. In addition to learning how to write a grant, you have to write a grant within the first year that actually needs to be submitted. So you get to try your hand not only at writing it, but then you submit it to NIH and it goes through the same process. But before you submit it to NIH, you get reviewed internally, which is a really strong aspect of this program that I didn't experience elsewhere.
Our system is very, very large, and so the opportunities for clinical work and research are very diverse. We have people who are experts in applied treatments of all kinds. We have people who are experts in genetics and imaging, and also, different kinds of approaches to specific areas of psychopathology. So there's just a wealth of research training that's available and clinical opportunities that are available in the system because of our size and the expertise of the faculty who are here.
There's always something to learn. There's always some way that you can expand your research into a different way if you're interested.
People are nice, people are collaborative, it's a pleasant place to be. You're not going to hate your life if you're here, which you can't say of all places, you know what I mean? It's fun, it's nice. I like the people I work with, I like what I do, and I feel like I'm able to do all the research I want to do. The people I work with are passionate about what they do, and I feel like we have a dynamic where we can concentrate on our work, enjoy doing it, and not worry about stupid stuff.
Brown is an excellent training environment. It's really very supportive of trainees, and there are just so many opportunities here. So if you come with a specific research interest, it's very likely that you're going to have an excellent faculty match here and somebody who can kind of help you along your way to being an independent investigator.